This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, my name is Martha Catalanato. I'm the Administrative Chief Resident for Baylor College of Medicine, PM&R Department. I just want to take a quick second to thank you all for joining us tonight and taking some time out of your busy schedule. Later on in this presentation, I will have Christian Van Giesen, who's our Academic Chief Resident, take over the latter half of this presentation. So here is our current classes, PGY2 to PGY4. We are an advanced PM&R positions here, and we take 8 residents per year. So just to give you some insight into Houston for those who have not been here, I'm actually not originally from Houston, and I've loved my time here thus far. It is a great, very large city. The cost of living here is fantastic on a residency salary. And the diversity that the city has alone is just unbelievable. You can get food from all over the world. Additionally, we have some great weather. The average temperature is about 68 degrees year round. So winters are not brutal. Summers can tend to get hot and humid, but they are definitely bearable. And then additionally, like I said, we are just a huge foodie city, from tacos to Thai food and everything in between. And it was just named one of the top 10 foodie cities in the country. Additionally to it being a great city, it is a great place to do your medical training, and that is largely part due to the Texas Medical Center, which is the largest medical complex in the world. There is basically an entire skyline here in Houston, just dedicated to hospitals and hospital administrative buildings, all in one spot that's highly concentrated. It is home to one of the world's largest children's hospital, which is Texas Children's, which we actually have the opportunity to rotate, and I'll get into that in just a little while. And is also home to one of the world's largest cancer hospitals, and it was just voted the #1 cancer hospital in the country, which is MD Anderson. So despite being a resident at Baylor, you have this Texas Medical Center right at your fingertips. Everyone is very collegial in this medical center, and you will find everyone is willing to help you out, work on and collaborate on projects. So you are part of one institution, but once you're here, you're really a part of a bigger environment altogether. So when you're resident here, you're going to be rotating at various different rotation sites, and this is just a list of all of them, and I'm going to quickly go into each one of these and talk about what to expect. And then just in the top right corner in your screen here, you're going to see an aerial shot of just the Texas Medical Center. So like I said, it is legitimately its own skyline here in Houston. So the first site one of the first sites we rotate is Tier Memorial Hermann, and this is one of the top rehab hospitals in the country for the last several years. It is a model system for both brain and spinal cord injury. And here you'll do mainly inpatient rotations in brain injury and spinal cord injury. And most of the time with the patients here, they're all going to be acute, meaning they just had their injury and this is their first bout of rehabilitation. You'll have exposure to some spasticity management on the inpatient setting, doing Botox and phenol injections under ultrasound. And here you'll also learn a lot about intrathecal baclofen pumps, who to predict would benefit from an intrathecal baclofen pump and how to do trials in an inpatient setting. Additionally, you may have some EMG exposure and trigger point injections, just as a lot of these inpatient patients have a lot of musculoskeletal complaints as well. Here is our Baylor McNair campus, and this is where you're going to have outpatient experiences only. You'll rotate through sports medicine, pain medicine, and just general rehabilitation clinic. In sports medicine, you'll have exposure to ultrasound-guided peripheral joint injections, and on the pain side, you'll have most of your exposure with fluoroscopic injections as well with our pain attendings. As far as general rehabilitation, you'll really see the whole gamut from post-stroke to amputation to prosthetics and orthotics. It's a really great rotation, and the attendings here are just wonderful and always willing to teach. Next, we'll go to Baylor St. Luke's, which is the acute care center associated with Baylor College of Medicine. And this is actually one of the best cardiac centers in the country. So a lot of cardiopulmonary rehabilitation patients. Here, you're only going to be doing consults, and at the consults mainly will be asking for dispo, but most recently we've also picked up consults for pain management. So you'll have a little bit of insight into opioid management while you're here as a resident as well. And like I said, that's relatively new and is evolving with time. Next, we have the Michael E. DeBakey VA. This is one of the largest VA medical centers in the country, and you'll have an exposure to the spinal cord injury unit, the general rehab unit, and then on the outpatient setting, we have a musculoskeletal clinic, EMG clinic, and a prosthetics and orthotics clinic, which you don't spend too much time at normally, but if that's something you're interested in, it could definitely be worked out. Most of the inpatient spinal cord injury patients here are chronic patients, meaning they've had their injury many years ago, and we are now taking care of new medical issues that may arise. You'll have some great exposure to wound care, and you'll work very closely with plastic surgery, infectious disease, and urology specialists while you're here. Throughout the week, you'll have multiple multidisciplinary meetings, and it's a great way to learn about spinal cord injury and how other specialties can and need to be involved. Next, we have Ben Taub, which is our county clinic, and here you'll do consults, and this is a great area to get exposure to polytrauma and traumatic brain injury and spinal cord injury. And now we have Gulfgate and Smith Clinic, which is the Harris Health County Clinic. So here are all outpatient, and again, it's a lot of general rehabilitation and EMGs. I would like to point out that when you are here, you're going to have no problem getting your numbers when it comes to EMGs, Botox injections, peripheral joint injections. The way that our schedule is laid out, we really do set you up for some success. And this is TCH. This is one of the largest pediatric hospitals in the country, and you'll have inpatient exposure as well as some outpatient exposure to a lot of the bread and butter pediatric PM&R needs. This service is very busy when you're on inpatient. The consult service can sometimes get very large, and you'll get very good at managing spasticity and dystonia in the pediatric population. And I'll let Christian take it over from here.
Thanks, Marissa. Hey guys, Christian Van Giesen. Talk a little bit about our curriculum. We really try to keep it longitudinal and similar for most residents. So we meet all the ACGME requirements for inpatient rehab rotations, usually more front-loaded in your PGY 2 year, get between 6 and 8 months, and kind of pick up the rest as you go through your PGY 3 and 4 year. Like Marissa had mentioned, some of the other sites, we get a robust exposure to all different types of musculoskeletal, EMG, pain medicine. And as well, with our EMG experience, we have Dr. Fei Tan, who's one of the authors of one of our textbooks that we use a lot for EMG. So she's fantastic in giving us guidance. She's over at the County Health Center at Smith Clinic. And then with the rehab experience too, I think one of the highlights is our pediatric rehab experience. We have a really large group of faculty that's continuing to grow and expand that has really pushed our residency program and our pediatric fellowship to really good heights. Next slide. So this is kind of a rough outline of the sample schedule that I had mentioned prior. So if you look at PGY 2-year, a little bit more heavy at tier. We have a 3-month spinal cord injury rotation, where I think now it's all Spalding grads over there. So the VA patients get superb treatment from our VA attendings on the SCI unit, and then kind of parlayed that into the PGY 3-year, where we start picking up a little bit more outpatient exposure, especially at Texas Children's. We get 3 of our 4 months at TCH during our PGY 3-year. And then PGY 4-year, we're able to pretty much exclusively do outpatient. You have the opportunity to flex some of those outpatient months into inpatient if that's something you're interested in. I know we have a few residents who have a clinical interest in brain injury, spinal cord injury, neuromuscular rehab. I think actually Marissa's doing one of those months as a PGY 4. So we are pretty flexible in trying to give you the exposure that you need. Next slide. And a little bit about our call schedule. So we have 4 total call pools now. It's again front loaded a little bit towards your PGY 3 or 2 and 3 year. I would say most of our call is pretty manageable. We average only a few calls a night, with the exception of tier. That can get pretty busy, and we get a post-call day the day after. So you go in the morning for about 5 hours, and then you rotate out after that. So as a PGY 4, I'm currently just took call at one of our sites, and I got 1 call in a week. So it's really dependent on rotation site and kind of where we're covering and what hospital we're working at. And didactics and scholarly works is kind of my bread and butter here. So we do didactics every Thursday morning, usually for about 3 hours between 8 and 11. We are putting a big emphasis this past year, and I work closely with the UT Houston academic chief resident. We have a collaborative didactics with their program on more of a case-based hands-on learning approach. I think over the years, especially as we transition back to in-person didactics and get breakfast, all that good stuff. I think we've all desired to be more interactive, to work hands-on with one another, to get more workshops in. So that's been the latest push of recently. We have a critical review of the literature that we do as PGY 3s, usually in the fall of that year, to enhance our research output as residents. You can also use that as well as a publication if you want to kind of continue to push those bounds, especially if that's something you're interested in. And then see, these are some of our other workshops: MSK, ultrasound, anatomy workshops that we do, injection-based courses. And then every year we do a QI project. A lot of times they're longitudinal. So you start as a 2, usually with a 4 who's your mentor. And hopefully you continue to either evolve the same project or create new projects every year. I think several people have made impactful QI initiatives that have gone to publication. And then in addition, kind of all the other stuff that you'd see in most other programs: M&M, patient safety, journal clubs, and our big comprehensive board review course. That's one thing that's unique about Baylor, that all the PGY 4s participate in. It's a national course, so a lot of people fly down here to Houston, and we have fantastic instructors who are both on staff at Baylor, and we also use some of our UT colleagues and the rest of the people around the medical center. So it's a nice touch to conclude your residency and test your knowledge before you go take your board exam, your written board exam. So these are our grads, and just kind of the lineage of how our programs match people. So as you can see, we pretty much match strong across the board, whether it be sports, brain injury, pain medicine, SCI, peds. We get a good mix of people going into different subspecialties. I know Marissa and I are both finishing up the pain cycle, and we have 2 other co-residents who all interviewed really well. So looking forward to ranking. I know we have a few residents this year in my class as well who are applying for sports medicine, and then 2 other residents who are interested in more general rehab. So it's a strength of our program that we have people match everywhere, and we have connections all across the country to kind of help facilitate whatever your interest may be. And this is just us as we do our socializing. The top picture is Marissa and I and the rest of our co-residents as PGY2s come into the program, and you can kind of see our evolution as we've grown up now. So we have a fantastic time together, and it's one of our strengths. I think Colton Ray, who's on this call as well, has kind of been heading up our wellness committee. It's been a big push for us from an administrative and just from a resident standpoint. It's been a great initiative, and we're really grateful to have the backing and funding from our department.
Hey, Christian, just want to give you a 5-minute warning.
Okay, yeah, we're wrapped right here. So these are just more pictures of other wellness events we've done. It's been a good experience, and I think the last one on the bottom is our recent graduation with some of our residents who have gone off and done big and better things. So we'd love to take your questions. Please. We're very open about our program, and we'll be glad to drop our emails in the chat as well. And these are, other people. Yeah, Marissa has her email, Kristen, our fantastic new program director or program coordinator, and Dr. D. And you can find us on Twitter, Instagram. I know people have been trying to keep those up to date. So please let us know what questions we can answer, and we're glad to help field them. What kind of special you guys get? So as far as MD Anderson, our program currently doesn't have a direct patient rotation there. It's something that we're working on right now to get a cancer rehabilitation or pain medicine rotation. Dr. D has been trying to craft new ways to do that. Marissa and I and several other residents do research over there, so we're very well connected. The UT program also has some connections over there, and they're pretty much our sister institution. So we know all their pediatric cancer rehab docs. They give us didactic lectures, so happy to connect everyone once you're down here in Houston. What aspects of the program are you most proud of? Can you highlight individuals? Marissa, do you want to take the second one? If she's on. I would say, like, as far as aspects that we're proud of, I think we recruit not only a diversity of people, but of talents, of interest in PM&R. We have really supportive attendings. I mean, some of them have become closer friends to me than true attendings, honestly. We hang out on the weekends, go play golf, get drinks, happy hour, things of that nature. As far as people I see as inspiring or role models within the program, I mean, one of our attendings, Dr. Janet Del Rosario, she's a graduate of our program a few years back. Just the amount and the breadth of exposure that in things that she's had to deal with over the past few years, just from a personal and professional standpoint, she's won our back-to-back years, our faculty favorite faculty from a resident, and then she won it from a department level as well this year, so she cleaned up the podium. She's an amazing person, and she's been a help for me both professionally and personally.
Hey, Christian, just want to give you a 2-minute warning.
Yep, sounds good.
Hey, Christian, I'm in. Sorry, I had some technical difficulties.
Oh, you're good.
I see a question about what differentiates Baylor from UTH. I think that was the next one.
Yeah, go ahead.
So like Christian said, we are kind of like sister residency programs where we do have the same didactic schedule, and we do share Tier Memorial Hermann as a rotation site, but otherwise we are very separate. All of our other sites are separate from UT completely, and we have our own program directors. I think it's really nice that we get to work very closely with UT because it's like our residency has gained 4 other residents. So you'll see all of us being very close. I just think they have a stronger emphasis on inpatient, where I think we have a very good just overall exposure to all things, both inpatient and outpatient.
Yeah, that's a great answer. Just going back to Lily's question about intern year. So we have 2 advanced, or I guess they're like pseudo categorical positions that you apply to as a when you're going through the application process. Those interns get a month with us, rotating in PM&R as they rotate through their internal medicine year. Otherwise, the other 6 positions are advanced. And then we can, I see we're out of time. We can keep typing in questions, and Marissa and I can hang on and answer these questions. And please shoot us an email if you guys have any other thoughts or questions or concerns. We're glad to answer them. Thanks for the time, guys. And we look forward to getting to know y'all hopefully here come interview season.
Thank you all.